our lab demonstration for several spatial operative devices we use uncommonly. And the first one, we will perform a microwave ablation for lung tumors. And let me introduce the history briefly. The patient is a 61 years old female, and he is a patient with colon cancer with a progressive lung metastasis. And the colon cancer was resected in 2011, and the primary tumor is a large one, with a size of 5.8 centimeter in diameter. And in the next year, the lung tumor was noted, and the lung metastasis was resected under VATS-assisted wedge resection. And however, the hematoma was noted only. And the right side liver there was a tumor noted, and the lobectomy was performed, and metastatic liver cancer was confirmed. And this time, indeed, this year we find several lung nodules, and VATS-assisted wedge resection was performed, and the lung metastasis was noted. And let's conclude this time. And now we can see there one small nodule was noted over the right side, and is progressed. And today, our expert will perform a CT guide microwave ablation for this lesion. And this lesion not only was noted in the CT scan, but also noted in the PET. And finally, we will have a small discussion between the operator and the moderator and all auditors here. And at the same time, we have another demonstration. And the other cases is a patient with HCC, and Dr. Liang and Dr. Lin and Dr. Wu, they will perform a bipolar radiofrequency ablation under ultrasound guide and CT examination. And the patient is a 65 years old male, and the child liver cirrhosis was noted, and he is also a chronic hepatitis C patient. And HCC was noted 2 years ago, and he used to receive partial hepatectomy and splenectomy. And then the recurrence was noted, and the test was performed in 2012. And then a recurrence again, and the radiofrequency ablation was performed 3 months later, and for 3 times. And this time, one recurrent HCC was noted at a high segment 7, and the tumor is small one. The size is about 1.5 centimeter, and he received the TAE marking 1 day ago, and the fifth time the TAFA will be arranged. And this is the tumor on the arterial face, well enhanced, and diminished in the delayed portal phase. It is a very typical HCC over here. And they will try to create artificial ascites, and then to perform operation by bipolar. And now let's start to connect the image from the operation room.
And part. Can I start this first check? Okay. We are moderators, and I'm Kanaza from Okayama, Japan, and Dr. Lin and Dr. Cheng. Dr. Lin is from Canada, and Dr. Cheng is Taipei. And today's operator is Professor Chang. And can you introduce? Let me introduce Professor Chang of the National Taiwan University College of Medicine. And he's a professor of radiology, and his focus is chest radiology, including intervention. Dr. Chang? Dr. Chang? Dr. Chang.
OK， 我这样可以讲话吗 ？Hi everybody, how are
Okay.
you? Good.
Can you listen to me?
Yes.
Okay. So could you start the introduction of your procedure?
Okay, this lady is a patient of colon cancer, and she had colon cancer resection, and the resection of the tumor of the metastatic tumor in the liver, and she had several metastatic nodules and were resected. But some of the nodules are increasing size recently. You can see from the, I think you can see the slide I prepared. Can you?
Oh yes, I have had seen the slide of CT scans of lung metastasis.
Yeah. So basically, she has more than one nodule. She has 3 target nodules, and they are increasing size compared to the study last year.
Okay.
So today we will target the nodule and the right lower lobe first.
Okay, I see. So how could you start your procedure? How about the anesthesia?
We will use the local anesthesia first, and then after reaching the target, then we will give the lady some fentanyl and domaquine for conscious sedation and the pain relief.
I see. And how do you use the image? Do you use a CT or a CT fluoro?
It's just CT. We will perform by a stepwise the localization of the target lesion.
Okay, I see. So could you start your procedure? Could you let me introduce your electrode?
I'm sorry?
What kind of electrode do you use? Needle?
We use the microwave, the med waves. That's you mean?
Yes, that's right.
Yeah. Could you show the pictures of the diagram to the audience?
I see.
To the audience.
I see.
Okay.
Exactly, I can.
Yeah.
I can understand. And the diameter of the needle is a 40 gauge?
It's a 16 gauge.
60 gauge. Okay, I see.
The size of the nodule is less than 1 centimeter.
I see.
So we plan to use the small size antenna to cover the tumor.
Okay, and in this time, what size is the tumor?
The tumor is less than 1 centimeter.
This time.
Distance.
This time. In this procedure, how large is the tumor? The target lesion?
The size of the lesion, or
yes, that's right.
The size of lesion is less than 1 centimeter. It may be about 7 millimeter or 8 millimeter.
Okay, I see.
In diameter, yeah.
Okay. So could you start your procedure, please?
Okay. 来，请你吸一口气哈，好，停住呼吸哦。好，可以呼吸，给我 Kelly 好了。来，请你吸一口气，停住呼吸。
The operator is explaining to the patient to withhold his
好，
breath.
好，可以呼吸哈，Kelly。我们先扫描一次哦哈，你注意听口令，身体不要动哈。这帮我拿起来好了。Yeah, we will take a scan now to make sure the direction of it.
So as we can see, there is a small nodule at the right lower lung field. And there seems a little distance between the nodule and the pleura. So, Professor Kanazawa, how do you think about the distance and the pleura? What should we know aware about the distance to the pleura?
I think that the distance in this tumor is very suitable for RF, and because the tumor locates maybe 1 or 2 centimeters below the pleura, and maybe it is very easy to get the position.
So there is very little distance from the nodule to the pleura. What kind of technique would we use if there's almost no?
We don't need such a very special technique. It's we choose the most shortest way from the skin and directly approach the tumor. Of course, we must avoid rib and just below the rib because of the injury of intercostal artery.
So it seems that there is no a very big vessel or bronchus nearby. So if there is, what would you recommend? That if there is a large vessel, or how large vessel, if there is nearby, we will expect the poor local control rate.
I think that we would like to avoid the hepatic vein or artery larger than 3 millimeter to penetrate.
Yes. So 3 millimeter would be an important factor for local control.
Yeah, I think so.
So we can see the stepwise localization. Now the antenna is so there, the antenna is now near the pleura. So
I think he will advance the needle almost the correct route. I think he adjusts the placement of needle more directly to the tumor.
张教授现在就是在，请问是在测量那个距离？
Dr. Chang, can you listen to me?
可以好，我们现在已经备好位置了，然后现在要先给病人一些 IV 的药，然后让他止痛哈。We will give some anesthetic medicine intravenous. Then we will puncture the lesion now.
I think that you get a very correct position. Dr. Chan? Dr. Chan? I suppose that he advanced his needle and confirmed the positioning of the needle again on CT scan.
So the pleura is very sensitive and is very subjected to pain. So I think it's very important to do some pain control here.
Okay.
So would it be sometimes helpful to do the epidural anesthesia before the procedure?
And we can find no pneumothorax in this case.
Adjust the needle tip a little bit. Okay.
Dr. Chen, the correct needle location or continue the procedure?
Yes, we will adjust the needle now.
Okay,
Yeah,
Please
it
try.
is a little bit medially. Yeah.
I see.
Professor Kanagawa,
Yes.
do we need to insert a needle in the center of the lung nodule?
I think that the tumor is not so big, but it is better to position the needle at the center of the needle.
Maybe put another, just left this.
It's one idea.
Yeah, putting back needle may cause tumor seeding. So
Yeah.
I see.
I suggest a second insertion.
That's a good idea.
Why did I use CT fluoroscopy?
It depends on his chit.
Professor Kanagawa, in your experience, you prefer to use like the multi-team deployment device?
We prefer, but the opinion of Yamakado is different. He has straight electrode. Dr. Yamakado, what do you think? What do you think, the expandable needle or straight needle? Which you prefer?
Both works, I think. It depends on the physician's experience, I think.
Okay,
Experience
thanks.
very important factor.
Okay, thanks.
So if we insert multiple needle at this time, do we switch into switch control operation or just do it separately? If we do it in the IFL and we do like this, we insert another needle, do we apply them separately or we use the switch controller to do the two needle ablation? What do you...
Okay, I think the position of the needle is acceptable now. So we will start to initiate the treatment program now.
Okay. Would you let me know the power, your initial power?
The power， 你可以照给他看吗？power 是多少？
Yes, I think that if Dr. Zhang, Professor Zhang, you continue to, so maybe we can change to the second room for liver tumor operation.
那个纱布要先准备一下。We have to prepare some skin protection with the saline on the gouge. The program is now set for 180 seconds. So according to the 180 seconds program, the lesion, the abrasion coverage will be about 1.5 by 2.5 centimeter. So it should be enough to cover the lesion in this case.
And would you let me know how long of the ablation time?
180 seconds. It's 3 minutes.
I see.
So we will start the first round, first session. 你给他 Domiquin 了吗？哦，好，他 skin 先那边先弄一下纱布再开始。你要，好，啊，你可以把那个针可能不要直接夹在那个electrode上面，夹在纱布上啊。Now.
Professor Chen, can you explain what you're doing right now, this protection of the skin?
Yeah, we use the weight gauge and use the saline to prevent the skin burn. And we will keep it wet in the whole procedure.
Are you injecting it directly into the tissue?
No, we inject on the skin, the gauge.